Good afternoon, everyone. Myself, Dr. Kanchan Durugkar. I am consultant at Oasis Fertility, Pune. Today we are here to discuss about the IVF process in detail. So, we actually see many videos on YouTube and many other sources where we gather the information which may be partially correct, which may be sometimes incorrect also. That what is the procedure, how the procedure, how long it takes, whether it is painful, not painful. So, with these all things we are going to discuss in this session from the fertility clinic itself. So I welcome you for the today's Facebook Live session, and the session is on the IVF process. What is it? That the process we are going to discuss in the detail. So I will be sharing my screen now. Can you please share my screen? Yeah. So this is the Dr. Mukhopadhyay. He actually, when the Louis Brown was born, after the 2 months of that, in India, Dr. Mukhopadhyay also had a success in IVF, and Durga was the first Indian IVF baby born after the IVF that was done in India. So she is also called as Manupriya. Now we will come to the journey. Basically, what is fertilization that we will see first, and then how, with the aid of natural things and the artificial thing, how the IVF process is carried out, that we will see. So, basically, what happens in the natural cycle? The egg is formed in the ovary, the ovulation is there, then the sperms travels from the vagina and it travels through the fallopian tubes, and then the fertilization is occurring, and after the fertilization the embryos form, and this embryo get implanted into endometrium, and the pregnancy is there. So this all process is happening when the natural conception is there. This all process is happening, and we are not aware of it. But in the artificial reproductive technique, this all things are done in an artificial way in the IVF lab, and this gives us the pregnancy for those couples who are not able to conceive with the natural way. But yes, the baby that is born is as same as the natural conception babies. Now this is the fertilization, how it takes place. The embryos that are formed, they travel, as I said, the ovulation occurs, then the fertilization takes place in the fallopian tube itself. Then the embryo travels from the fallopian tube to the uterine cavity, and in the uterine cavity, on day 5, day 6, the implantation takes place. What is implantation basically? The embryo that is formed, embryo is the a very primary stage of a embryo. Basically is a very primary stage of life, basically we can say. So in Hindi we call as a girl. So embryo get implanted into endometrium at day 5 and day 6, and after implantation is successful, we get the pregnancy as positive result. Now, what are the first we'll see what for the IVF is needed. So, what are the causes of infertility for which the IVF is advised to a couple? So, what are the causes of female infertility? They can be PCOS, which is very common in these days. That there can be a septate uterus, some congenital problem in the uterus, some anatomical problem in the uterus. There can be fibroid. Not every fibroid will lead to infertility, but yes, can be a cause. Then endometriosis can be a cause. Then polyp can be a cause. Blocked tube or some tubal pathology can be a cause, like hydrosalpinx or tubal blockage. That can be a cause. Then ovarian reserve, the diminished ovarian reserve, that can also be a cause. So these are the different causes of female infertility. Now, what are the causes of male infertility? Male infertility, there can be azoospermia, there can be oligozoospermia, there can be sexual dysfunction, there can be varicocele, grade 3, grade 4 varicocele, then there can be obstructive type, non-obstructive type. These are the different causes of male factors of azoospermia, which leads to which contributes to 30 to 40% of the causes in the infertile couple. Now, this is the process of IUI, which we will not discuss in today's topic, because today our topic is on IVF. But the patients who have failed 3 or 4 IUI cycles, 3 or 4 IUI cycles are failed. In those patients, IVF is also advised. Now, coming to the IVF. Now, what is done in the routine IVF? So, what we do on the second day of the cycle, we call the patients. We do the baseline scan, or the sonography, transvaginal sonography is done, and in that we assess the number of antral follicle, that is called AFC, that is antral follicle count we measure. Then after that we see for the endometrial thickness, and depending upon the day 2 or day 3 scan, we then decide the dose of the injection that is given. So in routine IVF, we give the injections from second day of the cycle for 12 days. So 12 days of approximately 12 days, not necessarily 12 days for every patient. It depends upon the response of that patient. So 12 days or 14 days of the injection is given to the patient, and after that the maturity injection is given, that is we call as a trigger injection. So this why this trigger injection is given after the eggs are matured, like we in the IVF, in IUI or ovulation study, if we see we have to have only 1 or 2 or maximum 3 of the mature eggs in the process of ovulation study or IUI. But in the it is different. Here we aim for at least 10 to 12 eggs. So the maximum pregnancy is achieved when we retrieve at least 10 to 12 eggs, mature eggs. So for that, to have these number of, actually the ovary produces 1 egg in 1 month or 1 cycle, let's say. But to have this much number of eggs in 1 cycle only, we need to give gonadotropins. What are these gonadotropins? These are the artificial hormones. These hormones stimulate the ovary to produce more and more eggs. So this is called as a controlled ovarian hyperstimulation. So it is under control. Why it is under control? Because we are monitoring it through ultrasound. So controlled ovarian hyperstimulation is done, and we monitor it with the estrogen blood test also. We can monitor the estrogen, rising estrogen level, and then after monitoring this estrogen level, when the mature eggs are seen, then we trigger the patient. Now, after the trigger injection is given, after 35 and a half hours. So at 36 hours, generally the maturity is there. So at 36 and 35 and a half hours, the egg retrieval, that is called ovum pickup, is done. So what is this ovum pickup or egg retrieval, oocyte retrieval? So whichever eggs are formed, matured, they are retrieved with the help of a needle. So this is actually a procedure carried out under short general anesthesia, where the patient will not have any pain or will not understand what procedure is getting carried out, because the patient will be under anesthesia, under sedation. A short sedation is given, short anesthesia is given, and then the procedure is carried out. Now, what happens after this egg retrieval? After this egg retrieval, the eggs that are formed, they are transferred to embryology lab, which is near to the OT of ovum pickup, and after they are taken to the embryology lab, there the denudation of oocyte is done, and after the incubation of these eggs, the ICSI is carried out. Like say after 4 hours after of the pickup, ICSI is carried out. Now, what is ICSI? So conventional IVF was where the egg was taken in a petri dish, and around it the sperms were released, and the natural fertilization, natural penetration was seen, and the fertilization was checked. Now, in the ICSI technology, what we do is the intracytoplasmic sperm insemination. In this, the egg is injected with a single sperm. So this is called intracytoplasmic sperm insemination. So this is the recent technology which has come up, and it is very useful for the patients with severe male factor infertility, where the egg count is less than 5 million. Basically, this ICSI technology came only for the patients with severe male factor, like the patients with less than 5 million count, where the fertilization was totally failed with conventional IVF. So in those patients with severe oligosteroidospermia, we call in the medical language, which means very less count. So in these patients, this technology came, and now it has become a routine practice for each and every patient of IVF, where the ICSI is carried out and the fertilization is checked. Now, on the second day, the fertilization is checked, and then uninterrupted culture also can be done, where the fertilization is not checked, and the uninterrupted culture is done, and direct day 5 embryo is seen whether the blast is formed or not. So after ICSI, the eggs are kept in the incubator. We have the incubators, modern incubators we have, where these ICSI eggs are kept, and at day 5 we see whether the embryos have expanded or not, and whether the blast have formed or not, and accordingly the freezing of this, whether we have planned for the fresh embryo transfer or the frozen embryo transfer. Accordingly, we freeze the embryos. So this is the exit. This is exactly what we see under the microscope. This is the human egg, and the needle. We can see the sperm which inject the sperm into the oocyte, and the fertilization is checked. Now, so this is how the embryo culture is seen. In this, first the fertilization occurs, pronuclear stage, then the second day, third day. These are all cleavage stage. Up to morulite, it's a cleavage stage. Then after that, the day 5 embryo, where we see some cavity, and it is called as a blastocyst. So the name of this day 5 embryo in our medical terminology, it is blastocyst. So blastocyst is the embryo, or the stage of embryo, we will say, which has a maximum fertilization potential, or maximum potential to give the live birth rate. So in Oasis Fertility, we use all this modern technology, that is intracytoplasmic sperm insemination, uh, uh, that is ICSI technology, then blast culture, that is blastocyst culture, that is day 5 culture, then again laser assisted hatching. What is this laser assisted hatching? In this, the outer layer, the zona layer, which is there the laser assisted hatching is done. Now, what this helps? This laser assisted hatching helps in the implantation of the embryo. So, the little hatching of this embryo, the laser assisted hatching, this is spots of laser is given on the outer layer of the embryo. So, what does this help? It helps in the implantation. So, this is done at the time of embryo transfer, just before the embryo transfer, when we thaw the embryos. Now, cryopreservation. This is again the recent advance that we use, that rather than going for the fresh embryo transfer, that is when the pickup is done, in that cycle only we don't go for transfer, we transfer in the next cycle. We freeze those embryo and we thaw them when the endometrium is ready next cycle, and then we go for the transfer. This is called as a frozen embryo transfer. Now, the frozen embryo transfer is has shown to be having greater pregnancy rate as compared to the fresh embryo transfer, and yes, it gives us the liberty of PGTA, and other testing if it all is required for the embryo, like embryo biopsy if it is required, then frozen embryo transfer is the choice. So these are all the embryo transfer technique, whether it is fresh or frozen. Basically, a frozen embryo transfer, why it is preferred over the fresh embryo transfer? Because it has proven to have a better clinical pregnancy rate as compared to fresh embryo transfer. Now, this is about the detail of the procedure. So, IVF procedure basically is a not painful procedure, though it is has duration to complete that. That is, first the stimulation is done, stimulation cycle is done, then the egg retrieval is done, then the embryos are depending upon the fresh or the frozen, the embryos are either frozen or transferred, and then after 14 days of the embryo transfer, we see for the pregnancy test, and accordingly the results are conveyed to the patient. So this is all the process of IVF in detail. Mm, pain, regarding pain, which is the main query of the patient. So during all this procedure, injections which are there, the recent injections that are there, that is recombinant injections, they're actually given subcutaneously, so they are not painful and they don't have any complication as such. Minor complications can be there, but routinely we use these injections, but they don't have any complication as such. And OHSS, which is the one of the one only complication which is seen in the process of IVF, that can be avoided with the frozen embryo transfers, which is the policy of Oasis. We go for frozen embryo transfer, which very much reduces the risk of ovarian hyperstimulation syndrome. So, ovarian hyperstimulation syndrome, that is OHSS, is having a negligible incidence because of all these recent advances that we use, that is the antagonist protocol, agonist trigger that we use, and the frozen embryo transfer that we go for. So this complication OHSS can very well be avoided. And other than this, the long-term complications can also be avoided. If the patients are worried about the multiple pregnancies, then in those patients, single embryo transfer can also be thought of if the couple is very much worried about the multiple pregnancies. So these are all the pros and cons and detail about the IVF process. If at all viewers have any query, they can put it in the chat box, or they can have helpline numbers on the screen. They can have a physical consultation with us. We have our clinic at Oasis Fertility Pune and also at Karadi. So I thank you all my viewers for patiently listening and viewing this Facebook live session. Thank you very much. Any questions from viewers? Okay. How long does IVF take to get pregnant? Okay. So basically, these questions is about from the day we start the treatment to the pregnancy test positive. I think this is how I will take it. So if we are going for the frozen embryo transfer, this process is of 2 months at least, because in 1 month we do the pickup of the patient and we freeze the embryos, and in the next month we transfer, and after we transfer, after 14 days we do the pregnancy test. So yes, after if at all, and the success rate of one cycle is 60 to 70%. Some patient may need a second cycle also. IVF has not 100% success rate. Its success rate differs from patient to patient also. According to patient's response, the cycle response success rate also differs. Age of the patient and many factors are there according to which the success rate will differ. So yes, the duration will be different according to the patients also. Any more questions from viewer's side? Is IVF is painful procedure. So as I already said in the Facebook live session earlier also, that in the IVF procedure, injections that we are giving, again, if the recombinant injections are given, they are given already subcute, then so they are very less painful. Like routine injections we take, like that, these injections are even less painful than that basically. And the pickup procedure, that is the egg retrieval procedure, that is done under anesthesia. So that procedure is also painless procedure. The patient doesn't understand anything because the procedure is done under anesthesia. Post-operatively, yes, the patient can have some type of pain, but for that we give painkillers. Then embryo transfer is just like IUI. It is not at all a painful procedure. Just we need to fill the bladder of the patient, and embryos are transferred with the plastic catheter, which is a very small catheter, and pass. We need to see the vagina with the bicelum. For that, the patient will understand that the procedure is happening, but it is not at all painful. And if at all the patient is very apprehensive, she is not tolerating the procedure at all, then we can do it. We can do even embryo transfer can be done under a short anesthesia. So that provision is also there with us. Okay. So some of my viewers are asking, how do I prepare my body for IVF? So basically, we need to actually do a primary evaluation of whoever wants to go for IVF. What is basically the indication of IVF for the person who has been advised IVF? So now, according to the patient, the preparation will be needed. Like if the patient is of low ovarian reserve, say. So in the low ovarian reserve patient, we need to give sometimes androgens. We need to give them sometimes some gels to apply before going, like 2 months before going for IVF. And if the patient is, say, suppose PCO and she wants to go for IVF, so in those patient, lifestyle modification in the form of weight reduction, exercise, these are the preparations we can say. And in some patients, pre-treatment may be needed. So this depends upon the patient to patient, how the patient will require the preparation. So that depends upon how your ovarian reserve is. What is your problem basically? Why you have been advised IVF? So that depends on patient to patient basically. Okay. So one of the viewers asking, how many injection do you need for a IVF treatment? So in this session only, I have told that approximately 12 days. I would say that 12 days of injections we give for the eggs to mature. Okay, but then again it depends. Like some of the patient may need only 10 days of injections. Some of the patient may need full 12 days, or some rarely the patient may need 14 days of injections. But generally, the 12 days of injections are needed. And how many? So that depends upon the response. If the generally one injection only is given daily, and one injection is added at sixth day. So two injections are needed basically daily for 12 days. Yes, so this is another myth basically, that IVF pregnancy is high risk. No, it is not high risk pregnancy. Yes, if at all the lady is having some metabolic problem, like the lady is having essential hypertension, or the lady is having diabetes mellitus prior to going for IVF, then she is a high risk, and she need extra care, I would say. So that patient will need IVF extra care. But as such, because the lady has undergone IVF, that doesn't mean that it's a high risk pregnancy, or it is something out of the world and she needs to have a complete bed rest. It is nothing like that. Basically, this is the myth that it is IVF pregnancy is a very high risk pregnancy, and the lady needs to have a 9 months of bed rest. It is not like that. If the patient is low risk, if the patient is going well, then she can continue. If she is a working lady, then she can continue working also. She can have a work life balance also, and yes, she can go ahead with a healthy baby. So I think these were the questions from our viewers. No, there's one question. So Nivedita, our patient is asking, how many injections I have to take after embryo transfer? Okay. So see, after embryo transfer, yes, we give some injections, but those are for like 15 days to 1 month, and that depends upon the embryo transfer. But yes, we give after embryo transfer some injections like low molecular weight heparin we give, then Then again, one progesterone support injection also we give. So yes, those progesterone, because it is an artificial pregnancy, it is not a natural pregnancy. So in these patients, we need to give some artificial progesterone support. So after embryo transfer also, there will be some injections. One of the patients asked, is egg count reduced when we go for IVF? No, it's not like that. Yes, we retrieve the egg, we retrieve 10, 12 eggs or more than that also during IVF, but that doesn't mean that your egg count will get reduced. Yes, if already the ovarian reserve is less, then in that case, yes, the egg retrieved number will be less. But IVF as such does not reduce the egg count. The egg formation is there. Whatever AMH is the IVF will not reduce the egg count. Your advancing age will reduce the egg count. I will wait for 2 minutes if at all our viewers have any questions. Yes. So I think we will close this session. Thank you all my viewers who have listened so patiently and asked their questions regarding IVF. If at all you have any anxiety or any queries regarding your IVF process, whether you have gone through or you are planning to, or you are in the process of IVF, feel free to ask any of your queries on your helpline number or physical consultation with us. So we are here to help you. Thank you very much. Have a good day. Thank you.